For most people, occasional lapses in memory are a normal part of the aging process, but sometimes not. As we get older, there are some normal memory errors that we make that are age-related. For example, misplacing your keys, having trouble finding a word while you're talking, even forgetting an appointment. That's not cause for concern. What I see is that when people make these errors much more frequently and they begin to disrupt their lifestyle, then we start to worry that there may be a dementia coming. A lot of people ask me, how can I maintain the memory I have or the thinking skills I have? Sometimes when we forget, it's not that we're forgetting information, but we're not actually absorbing it. So if you're having visual problems or hearing problems, or you've been diagnosed with those and you're supposed to wear glasses or hearing aids, please do wear those and get those kinds of things checked out. Secondly, sleep. Sleep is very, very important for memory. And we find that people who have inadequate sleep or disorders of sleep will have problems with staying alert and also problems with memory during the daytime. Drinking too much alcohol, use of drugs, and smoking. I would recommend stopping smoking because when you're smoking, you're actually taking oxygen out of the brain, and it can actually worsen your health in other ways. Stay intellectually engaged. Doing crossword puzzles or word searches, that's fine, but what research shows us is that when you're doing those activities and it's a social context where you're doing it with other people, it can be much, much more effective to keep you mentally sharp. So, get involved in book clubs, go to dance classes, things like that can be very helpful. Another important thing is exercise, and people don't always realize that exercise is important to brain health. 30 minutes a day, if you can, of aerobic activity can be very, very effective in promoting the health of your brain because you're pumping blood through your brain. Managing stress and depression, that's an important one. I think that a lot of folks who are having memory problems, what we find out is that they're having very stressful lifestyles or they're actually depressed. Many of my patients ask me what they can do in terms of aids to use to improve their memory. First, you can definitely write things down. That's probably the easiest thing to do, either in a cell phone or on a pad of paper. Using a calendar that's in a central location in your home to kind of mark down appointments and important information can be very helpful. Asking people to repeat what they say to you back, even if you think you've heard it, and then rehearsing what you hear back in your own mind can be very helpful in strengthening the memory trace that you get. Another memory aid would be using alarms. So if you have to do something at a certain time to program your watch or your cell phone to give you an alarm to remind you to do something. If you worry that you're having memory problems or you're worried about a loved one having memory problems, I think the first thing to do is consult with your personal care physician. There are many medical conditions that could cause memory loss. Medical conditions such as thyroid disease, vitamin deficiencies. There can even be side effects of medications that can cause memory loss. So you want your physician to be able to review those with you and make sure that that's going fine. Thanks for joining me. I hope this information has been helpful. For more information about memory and wellness, please visit conehealth.com/wellness. I'm Dr. Michael Zelson.